Good evening and welcome to all that are joining us for tonight's Allergy Foundation of South Africa's Atopic Dermatitis and Food Allergy live event. I am Dr. Candice Royal. It's my great privilege to be hosting tonight. I'm a pediatric allergologist based in a very chilly Cape Town tonight. And I'm going to be chatting through eczema, atopic dermatitis, and its relationship with foods. We as the Allergy Foundation seek to really be an interface between the public and experts in the field of allergy and immunology. And our goal tonight is to really answer your questions, to walk through some of the stories out there, and to bring a real authentic experience of what living with eczema and food allergies is all about. A big thank you to our sponsors, Sanofi, who've made this event possible. We're very grateful. And please, it's all about you. So please post your questions and answers and your questions in the chat. We will do our very best to answer them all in real time. But if we aren't able to get to your question tonight, we will definitely feed back to you after the event. This is streaming onto Facebook, but we will be uploading the event onto YouTube tomorrow. So if you prefer to watch it there or pass it on, please do so. So let's kick off with just basics around what really is eczema or atopic dermatitis. Are they different? So just to get down to the nitty-gritty, what really is this condition we're talking about? So eczema and atopic dermatitis, I'm going to use interchangeably because they really speak to the same condition. Atopic, that's just an inherent quality towards allergy. Dermatitis just means inflammation of the skin. So when we say atopic dermatitis, we're talking about an inflammatory, a chronic inflammatory condition of the skin that has some leaning towards allergy involved. But as we will further discuss, not all people who have AD or eczema have allergies, and that's an important point to make right from the get-go. What is this condition? So the way, and I'm sure if there are any of my patients on this audience, they're all going to have heard this before. The way I like to explain eczema is to think about your skin as your interface between your body and the external environment. So if you think about it like that, your skin is supposed to be a barrier, keeping the good stuff in and the bad stuff out. And think of that barrier as being just like a brick wall. So you've got your skin cells, which are like your little bricks in the wall, and you've got really important supporting structures that are like the cement and the scaffolding in your wall. And then, of course, you've got that plaster, which is like the oily layer of your skin, which really completes the barrier function of your wall or your skin. And when you've got eczema, what's really going on is that you're missing some of those key elements in the wall, in the barrier function of your skin. So you're missing some of those cements, a bit of the supporting structures, and you're definitely missing that oily layer, which is like the plaster on the wall. So what happens then is that your skin doesn't keep the water, moisture, inside. It's easily lost to your external environment. And then, of course, it's really easy for anything irritating or allergens, the wrong kinds of microorganisms to get into your skin. And that just sets up this inflammatory process. And then, of course, what happens is that you itch. And as you itch, you scratch, and then you further break down the barrier function of the skin. And that just sets up this vicious cycle that we see with eczema, where there's just ongoing inflammation, itching, scratching, worsening inflammation. And as I said, eczema is a chronic condition, so it can go on, for long periods of time with sort of times of flare and then times that are better, times of respite, and then it will flare again. So we anticipate that when we're dealing with eczema. So we're going to talk later about the management of eczema, but as I've said, because it's a barrier dysfunction problem, a problem of dryness and a problem of penetration of the wrong things, a lot of management hinges on restoring the barrier function of the skin. So how does food interplay with eczema? So the first thing to say is that we often think that what we're eating must be causing the barrier dysfunction. Actually, it's the other way around. So children who have eczema are more likely to develop a food allergy. And the reason for that is because it is easier for the allergen to be introduced into their immune system for the first time through their skin because the barrier is not working. So we're supposed to meet foods through our gut first because our guts are designed to tolerate foods. So the immune cells of your gut are different to those in your skin. When they meet food, they tolerate it. When your skin immune cells meet food, they can sometimes produce an allergy instead of a tolerance. So that's why we see children, especially children with early onset and moderate to severe eczema, are much more prone to having food allergies. Taking it a step further is that it's not always as simple as that sounds, right? Just like everything in life. So children with eczema are more prone to having immediate type food allergies. So those are food allergies that we're all more familiar with. You eat a peanut, you get hives, you get swelling, you possibly can have systemic responses, even anaphylaxis. But there are other types of food allergies that we group together in this sort of nebulous category of delayed type food allergy. And that's when the reverse may happen, but this is a minority of individuals. So the majority of food reactions that are related to eczema are because of the eczema setting up an immune response for an immediate type food allergy. There are a very small group of individuals that may get flare-ups of the eczema because of the food that they're eating as their only symptoms. And that would be part of the realm of delayed type food allergy. So typically occurring 24 to 72 hours later, you eat the food and you get a flare of eczema. But really, I need to reiterate that is the minority of people with eczema. The majority either have immediate type reactions to food, which is quite easy to pick up because there's a temporal association between eating the food and having the reaction. And then the very, very small amount of people that have delayed type flare-ups of eczema because of foods. And then there's a whole group of people that just have eczema all on its own without a food allergy at all. But we can go deeper into that. And please, I can already see questions are coming through, which is great. So please keep posting a question. I am now going to introduce our very special guest, who is actually a mum to two patients of mine. And I've been very privileged to walk an eczema and a food allergy journey with them. So welcome, Lee. And thank you. We can't actually thank you enough for giving up your whole evening to share your story. We know there's been hardship, there's emotion there. I think that the audience is really going to appreciate hearing from you, and I'm sure her story is going to resonate with many of you out there. So let's hand over to Lee. Lee, do you want to just tell us a little bit about yourself, your family, just to kickstart the evening?
Sure. So I'm a mom of two. I have a daughter who is 3 years old and a son who's 14 months. We live in Cape Town with my husband. I'm a writer and a copy editor. And I didn't, when I thought about having children and when we had children, I didn't ever think that I would be someone who would be able to talk about having children with eczema and children with food allergies. But here I am. It's been a journey, but yeah, we've come a long way, and I'm very happy that I've had Candice with us to guide us, because you've obviously, Candice, have been a great support through this whole process.
Right. Thank you. And yeah, again, just thank you for your time. Do you want to maybe share with us your initial journey with Harriet, who's your firstborn, your daughter, and how you discovered she had eczema and what that all felt like?
Yeah, so with both my kids, the our eczema journey started quite early. They both had baby acne, which never resolved, and then we realized it was eczema. Harry, yeah, she had her eczema was all over her body, but it was patches. It wasn't um, like a full rash over her entire chest. She had patches all over her body. Um, yeah, it's quite stressful when your child has something that you don't fully understand and you don't quite know how to fix. But I feel like we were quite lucky with Harriet, because her her eczema responded to medication quite quickly. Um, so we used Elidel to begin with, and her skin reacted really well to that. Um, Further down the line, as she got older, her flare-ups less, became less, and we started using a cortisone emollient mixture, and we'd use that for 5 days, and everything would go away. Um, but yeah, so now she's 3 and a bit, and her flare-ups, I think she has one now, but she's been sick. But this has been the first one in quite a few months. Um, so it was a long process. It wasn't a quick fix, and we did rely on steroid creams to treat her patches. But yeah, we're in a good place right now. So it's amazing to see how her body has adapted and strengthened, and she's hopefully outgrowing it.
Great. No, that's amazing. And what
Yeah.
about with Ellie?
So Ellie has been more tricky and more stressful for me. He started the same way, but his rashes seemed to be all over. It was like his whole body was rough. His whole chest, his legs, his arms. Yeah, it wasn't patches, it was full on. Um, it took a while so we also used Elidel with him, and that had no effect. For us, it didn't seem for him, it didn't seem to work at all. So we moved to steroid creams mixed with an emollient. And it's working, but we use it every day. So we haven't been able to wean him off yet. And it's only recently, so now he's 14 months. It's only recently that we can touch his skin and it's soft and there's no like rough patches. He has problem areas that we just don't seem to be able to fix yet. His thumbs and his forefingers, and like this area on his hands and around his mouth are really tricky. And yeah, I wouldn't say that they are close to being fixed, but the rest of his body is responding. So I'm hoping he'll take the same course that Harry did and will slowly outgrow it. But I'm less convinced with him. But he's still young, and it's still the beginning. So hopefully,
Sure.
yeah.
And what kinds of emotions does a family go through when you have a child that's rashy and itchy?
So it is stressful. It's hard to, yeah, it's hard to have a child that has a rash that you can't fix. And when you're treating it and you're doing everything you're supposed to, you're moisturizing twice a day, you're using the creams, you're using the medicated creams, and things don't get better, it's hard. And for me, it's seeing those rashes really brings up a lot of anxiety in me. Luckily with both my kids, I haven't noticed that they've been super uncomfortable. They don't scratch continuously. So that's been great. But seeing the rashes and seeing the dry skin and the red, and his thumbs, like they'd get cracked, they become, sores, like open sores. It's really, yeah, it's really stressful to see. It's not great. Um, yeah, I don't, it's hard to put into words. It's just an anxiety. It's an anxiety that doesn't really, it fades over time because you get used to it. But another side of it now is, obviously it's winter. There's lots of different things going around. Ellie, my son's been sick 3 times in the last 6 weeks, and every time his eczema's flared up. So now, if we see a flare up, we're like, okay, is he getting sick? It's that, an extra layer of anxiety. Is this just a flare up, or are we about to like have sleepless nights of fevers and all of that? So, yeah.
Yeah, not easy at all. And I said, a journey with a child with eczema is a super hard road. And I'm sure there are a lot of people out there that really have been in the same place. It's not easy. There's no quick fix, unfortunately. We always say you can manage eczema, but unfortunately you can't cure it, which is a really difficult diagnosis to live with for your loved ones.
Yeah, definitely.
You spoke about moisturizing twice a day. I think that's one of the key aspects of eczema management that we just really have to reiterate. So the only way to restore the skin barrier is to put the good things back into the skin. So your moisturizer is just so important. You've got to have a moisturizer that's got a high oil content. That's really important because that's what gives you that plaster back onto your skin. And sometimes we have to put it on a lot of times during the day. So often we say to people, every single nappy change, you need to be moisturizing your child, and that is super labor intensive as a parent. And it's a huge burden to bear, but those are the realities of living with a baby with eczema. I think what was so great that you highlighted with Harriet is that actually the good news is eczema is worse in your first year of life. It's a much more diffuse picture, and as children get older, it tends to be less acute, so less sort of red and angry and inflamed, and it tends to become sort of more dry and chronic, and it tends to become more localized into patches. And I know you're not quite there yet with Ali, but I think you have seen already that this sort of diffuse picture is fading, and the more localized picture is coming to the front.
Yeah.
What would you say worked for you with your eczema journey, and what really didn't? I know when you have a baby, there's a myriad of advice that you're faced with, just in general. But when you've got a baby with eczema, everybody's got a solution for you. So can you maybe share for us what worked for you and what didn't?
I think what the thing that we did that made a pretty big change was we used the bath oil with both kids. So that just helped moisturize them without us doing the labor of like getting it into all the like nooks and crannies. So I think we actually noticed quite a big difference with Ali once we started using bath oil. But yeah, doing the moisturizing, at least twice a day. We used Aquaphor with Ali, multiple, like, every half an hour it was attacking his fingers, and his chin with that. When he napped, I would layer it on thick, like, like a thick layer. And that helped because once he was asleep, he couldn't wipe it off because obviously a baby, everything's going in their mouth. So really focusing on when he was asleep and really attacking those spots then. yeah, I would say those are the that's what we did that seemed to help. Obviously, you have to be consistent. You can't be, one day do it, one day not, because you're not going to add any benefit. So consistency, really staying on top of it, applying as often as you can, and yeah, keeping a level head and not trying not to be anxious about it.
Right. No, I think there's the temptation to also change between products all the time and buy different things. But the truth that we must put out there is that the key to a moisturizer is that it's one that you're going to be able to use lots and lots of, one with
Yes.
good oil content. The Allergy Foundation has a seal of approval as well for um, moisturizers and actually all products marketed for allergies. So that can also help guide you, but don't get too bogged down. You just need something that you're going to use, and you're going to use it often and regularly, and don't switch between things. Just be consistent. It's an excellent message. The other thing you mentioned there about is an oil for washing rather than a soap. That is so critical, because anything with a soap is going to strip what's left of your skin barrier. So we absolutely cannot use anything soapy or foamy for eczema skins. No fragrances. Keep it simple. Washing with an oil so that your child actually needs to feel. We say they need to feel.
Yeah.
Really, at all times. That's so important in eczema.
Yeah.
Something that you and I never implemented with your children is a principle called wet wrapping, which is a really useful tool. And if you go onto the AFSA website, we actually have information about wet wrapping your children. This is especially effective if they have really the diffuse acute eczema. And the principle is to restore the moisture back into the skin and help rejuvenate the skin barrier. So what you do essentially is bath your child, put on the moisturizer really thickly, and then clothe them with a wet layer followed by a dry layer, and then they sleep with that. And in doing that, you actually allow the skin to absorb the moisture from the wet layer, because the dry layer functions as an occlusive layer. And it's an extremely effective way of managing eczema. And we believe in that so strongly that AFSA has actually is distributing something called Kitty Calmware, which is just an easy way of applying wet wraps to your children. So if you are interested, you can have a look in the chat box. Sorry, in the comments section, and there's a link to the Kitty Calmware that's available. Lee, let's go on to talk about your children's food allergy, because not only do they have eczema, but unfortunately, as mentioned, children who have early onset eczema, moderate to severe eczema, are more prone to developing food allergies. And that was unfortunately the case for both Harriet and Allie. How did you first find out that Harriet had a food allergy?
So it was during the allergen introduction phase of her solids journey. So we did all the major allergens, and I left peanuts till the end. For whatever reason, I was so nervous about it. Eventually did it and mixed a tiny bit into some yogurt, fed it to her, and she had a severe reaction. So she got a runny nose, and then she started getting hives, and then she threw up. So we took her off to the emergency room, where luckily it didn't affect her breathing. But yeah, once we were in the hospital, they asked if we wanted to test through a blood test. We said yes, and yeah, those results came back as a bad peanut allergy.
I think there's some important points that you brought up there, and something that I'm quite passionate about is just to increase awareness that children with eczema could potentially have a food allergy. And if possible, it's great to test them before you actually introduce the major allergens to keep them safe. And also because early introduction is protective. So that's a big switch in a lot of people's minds, because the thought is, surely if they've got eczema, we must delay introducing major allergens, but actually the opposite is true. So if they are not allergic, we want to get those foods into their diet really early, because we know that's protective in the long term. There's a lot of great data to support that, especially with peanut. So it's a very, very important point that you brought up there. And I think we did that actively with your children, bringing in the allergens, keeping them in the diet consistently to prevent other food allergies from emerging.
Yeah.
The second thing is to say also the recognition of a food allergy, really important. And you guys acted so great. You were, very much on the front foot, got her to a safe place, which is really what we want. So an immediate type food allergy can be mild in that it can just be a skin reaction, so hives, flushing, maybe a little bit of swelling. But the moment we see multi-system involvement, that's actually a severe reaction, and that can progress to a potentially life-threatening scenario. So it's really important to seek help early if you see that developing in your child. So how did Harriet having a food allergy impact on your lives as a family?
It was terrible. I took it really badly. If I think back to that week that we found out, I don't know how I got through work. I actually took a bit of time off. It was such a, when I found out, I didn't view it as we can keep her safe and she might not have an allergic reaction again. I saw it as, she has a peanut allergy, she's going to have a reaction. We're going to be doing this multiple times, rushing to the hospital, giving EpiPens. I'm an anxious person to begin with, and that it was really, really stressful. I just felt so out of control. I felt like I couldn't control this problem. So my immediate thing was to limit all interaction with her, with outside people. So wasn't really a fan of play dates. Was very cautious whenever we did go out. And that's right. Always, if we were going to see anyone, have you eaten peanuts today? Have you wiped properly? Does your child have peanuts? Do you have peanuts on you? Peanut butter, like, do you have peanut butter smeared on your face by mistake? It was very, I went into very serious, trying to mitigate every possible risk. It did get easier as I got more used to the idea, and I saw that she did have a normal, happy life, and it wasn't a matter of when, it was a matter of if. I relaxed a bit, but yeah, it's really not a nice thing to find out about your child. And yeah, as I said, I think it's the lack of control, the seeming lack of control over her safety that really stressed me out the most.
Very isolating as well.
Yeah.
Thank you for sharing that. Lee, you mentioned that Harriet had a blood test, so maybe we can just chat about the ways of diagnosing a food allergy. So the immediate type food allergies can be diagnosed on either a blood test or on a skin prick test. You're quite familiar with the process of skin prick testing. Just give us your thoughts around putting your children through those kinds of tests. What does it feel like? What does it involve?
So Yeah, the blood test actually went really smoothly. Surprisingly, Harry was only 6 months, but it happened. Yeah, it went smoothly. Um, the skin prick tests are have also been really great. They have got a bit trickier as Harry's got older because she's um yeah, she gets nervous about things or um yeah, I don't know. I don't quite know what goes through her mind, but she doesn't want to have it done, even though you can't feel it. You've done the test on me to show her that it's fine, and she's still nervous about it. But yeah, I think also having the skin prick test is also anxiety inducing because you're so hoping that nothing flares, and you praying like I try not to look because if I don't look at it, maybe it won't happen. Um, but then you do see, and there's this like welt. It's not a great feeling. Um, yeah, I don't know if I've answered your question well enough, but yeah.
It's a very anxiety-inducing moment,
Mm,
whichever way
mm,
one does it. Um,
yeah,
but there are good things to do because we want to keep people safe, right?
yeah,
Um, so, so just for everyone's understanding, those tests look for the allergy antibody against the food, either in your blood or by putting it into your skin. Both are really good. They're pretty much equivalent in terms of their positive yield and their negative yield. The advantage of a skin prick test is that you get the answer then and there without a blood draw, but the blood test can be done very safely and you don't have to go off your antihistamines to get it done. Both are widely available in the private sector, in the public sector, unfortunately, are limited to tertiary facilities that have allergy service. So a little bit more difficult to access, but good things to do and very important information um, that gets achieved by doing those tests. Is there anything else you would like to share about your experience of being a parent in a community with a child that has a food allergy?
um, I think what's important is to try find someone who is going through the same experience as you. um, I think obviously it's always helpful to be able to share your concerns with someone. um, it is a it's a it's a really tough journey, but it doesn't have to mean the end of the life that you foresaw for yourself and your child. Um, you can keep your children safe. It takes a lot of work and a lot of thought and a lot of preparation, but there are ways to navigate it. So it's tough, but finding a community that you can share your struggles with, because they are big struggles, um, is important. And yeah, I don't know. It's it's not great, but it's not the end of the world. It doesn't have to be the end of the world.
Thank you. That's really good to know. And yes, we want people to find their community and their support, and that's why yes, AFSA actually offer private support groups that you can join, and these are for people with eczema, atopic dermatitis, for people with food allergies, or even with celiac disease. And those, once again, links are shared in the comments section. So please go ahead, click on those, find your people. We don't want people to be isolated in these difficult journeys. And we, as experts in the field, are also very much in touch with those groups, and we're available to help with answers if we can. I'm going to next introduce Claudine. Um, Are you there, Claudine? Yes.
Good evening. Thank you, Candice. Thank
Take
you
it
for.
away.
Okay, we have a very exciting opportunity for our audience to join a atopic dermatitis workshop on the 21st of August in Johannesburg. It will give you an opportunity to have a voice, to learn how to properly manage eczema, and to interact with some experts. We have a very limited amount of people that can attend the workshop, but please contact the Allergy Foundation and reserve your spot and come and join us. Come and ask questions, come and learn and participate. I want to encourage all of you to ask questions and to learn how to help your kids and to help yourself. I thank you, Lee, for telling us your story. We are all parents, and we try and support our kids. We're not professional public speakers. So, yeah, I think it's important that we join together and form a community and help each other. Thank you.
Thank you, Claudine. So one of our prerogatives as the Allergy Foundation is to really create advocacy for atopic dermatitis. We believe that people with this condition need a voice. They need a space to communicate their needs. And we really want to encourage anyone who feels passionate about this to join that event or to even just join the eczema support group. We need to know what you as caregivers or as people suffering with eczema need, and how we can support each other and also advocate for your needs from a medical perspective too. I'm going to quickly, I can see lots of questions coming through, so I'm just going to quickly read some of those out and really give some answers. So the first question is, in speaking to other parents of children who have eczema, I've heard staph infection mentioned a few times. What is this and what has it got to do with eczema? Okay, so that's really great because staph is just short for staphylococcus, which is the name of a bacteria that is really closely associated with eczema. So I mentioned that when you've got this barrier dysfunction, that it's easy for the RON bugs to grow on your skin. And we see that with eczema. So people that have eczema flares, it's often associated with an increase in this bacteria's colonization of the skin. It doesn't even have to be infection. It can just be just simply the presence of staphylococcus on the skin. And that can really just cause the eczema to sort of spiral and again create that vicious cycle. So that may be something that needs to be addressed in managing your eczema control. So to keeping the staph at bay. And some of the measures we have for that is either active treatment with antibacterials, topical or systemic, or even things that just seek to sterilize the skin. So it sounds funny, but we actually promote putting bleach into your bath tub twice a week if you're known to colonize with staph, and that actually just sterilizes the skin and reduces the staph load on the skin and prevents that vicious cycle from being set up. Okay, I've got another question from Sandra who says, my daughter is 3 and has eczema. She gets really stubborn outbreaks. We have a mixture with Advantin, does have cortisone, and there's a concern there about cortisone and what its impact has on the skin. And I think, Lee, you also alluded to that. And maybe just let me know if I'm wrong, but when one puts steroid onto your child's skin, I think there's a measure of anxiety that goes along with that, just in the basis of putting something that we believe not to be good for our skins onto your child's skin. And I want to address that because, yes, steroids are something that needs to be used with care and always with supervision. That must be said. We know that there are a lot of pharmacies out there that will dispense steroid mixtures without the input of a healthcare practitioner, and we really want to speak against that. But if the skin needs steroid, it needs steroid. You're doing damage to your skin by letting the eczema be untreated. That also causes skin scarring, thinning, pigment change, discomfort to your child. Eczema is inherently itchy. If it's not itchy, it's not eczema. So yes, steroids, we need to be cautious, and we use them in what I call a proactive fashion. So using it to keep the skin at bay rather than using it only to treat these massive flares where you need to put loads of cortisone on just to get the skin back to baseline. We try to use limited amounts to rather maintain the skin if that's needed. Not everyone needs cortisone all the time, but if that is needed, then it's better to treat the skin properly with a steroid than to let it become completely uncontrolled. You're going to do damage to the skin doing that, and you're going to use more steroid in the long term because you're going to be treating aggressively a major flare. So that's not good for the skin. Next question. I see somebody who's had eczema for 20 years. Are there alternatives to cortisone? Cortisone-free creams never work. It's costly. That is very an important point to make. It is very costly. So what are the alternatives? So we do have alternatives to cortisone creams. And again, Lee alluded to using Elidel. So Elidel and Protopic are also anti-inflammatory creams, but they're from a different group. So they're not actually cortisones. They also address the chronic inflammation of steroid, but they're not as strong. So they don't typically treat it as quickly or necessarily as effectively, but if the eczema is milder, you can often get away with using them instead of a cortisone. So that's the one option. Again, your healthcare practitioner can guide you in what's the most appropriate therapy. And then if you've got really refractory eczema, there are other options out there. And I think we've reiterated this previously in our eczema chats. If you're not winning with steroid alone, please don't think that that's the end of the line. There are alternate therapies, so you need to find a healthcare practitioner who has experience in managing eczema that can help you access those other therapies, so that those can be immunosuppressive, it can be light therapy, or it can be things like biologics, which we're very excited about, but struggling to access for our eczema patients. And which is another aspect that our advocacy group is really working at to try and help us to access these important medications for refractory severe atopic dermatitis. So cortisone is definitely not the end of the line. Also, sometimes just treating your allergy, it can help you get over the line with your eczema. I'll come back to some more questions just now. Let's go back to Lee. In terms of your children's food allergy, where did you go to from where we've left off?
So with Harry, we just abstained 100%. All peanuts were out of the house. She was not in contact with any peanuts out of the house. She started school. We asked the school to be peanut free, and they very luckily were happy to do that. We would come for an appointment with you every 6 months to retest, do a skin prick test. And I think for the most part, her reaction stayed the same until the second last one we did, and then it got a lot bigger. And then you suggested that we start with oral immunotherapy, which we did. Yeah. Do you want me to? I just yeah, so we've actually started with Harry and Ellie because we found out that Ellie has a cashew allergy, not the same as Harry. Um, yeah, so with Harry, we started OIT, and that was a long process, but we've stabilized with her, and I think at her last skin prick test in March, her reaction was smaller, which was very exciting.
Very exciting. And
Yeah.
how many peanuts is she eating again?
She's now eating 6 peanuts a day, if we can get her to eat the peanuts.
It's also enough for her. But
Yeah.
it's great. So just very briefly, because this is sort of outside of our AD talk, but food allergies are tricky. They're really hard on a family, and it's difficult to live knowing that your child could potentially have an accident at any moment. Oral immunotherapy is our only way of potentially negating that risk, and the idea behind it is that you sequentially updose from really tiny amounts of peanut or the allergen to really the good doses of the allergen that the child eats on a daily basis to take away that risk of a potentially severe allergy, and hopefully to actually teach your immune system to not fight that food anymore and to cure the allergy. So that is out there. And if you have a child with a food allergy that is severe, yeah, it's something to explore. To go back to our eczema questions, does eczema get better, Lee? Is there light at the end of the tunnel?
So, yes, there is. My kids have both been lucky enough to have improved. As I said, Harry has very mild flare-ups, very seldomly now, which, back when she was 6 months old, you can't imagine kissing your baby and not feeling rough skin. I think that I wanted to say earlier, that's one of the hardest things, just touching your baby and not getting baby soft skin. You get this scaly, rough skin. That is so hard for some reason. So yeah, Harry is great. Ellie, we're getting there. I have high hopes that his hands will heal once he stops putting them in his mouth every 30 seconds. And his chin will heal once he stops drooling all the time and stops teething and stops eating. And, so there is light at the end of the tunnel. You don't think there is when you're in it, but there is.
Thank you, Lee. That's really great to hear your experience. I'm just going to answer some more of the questions that have popped up. Meal ideas and lunchbox snacks for a daughter with severe food allergies. Recently had to adopt gluten-free, dairy-free diet. Rice, apples, and kiwi have all come up on the Alex test now as allergens. Okay, so that's a really good question, and I don't obviously have all your clinical history to give a focused answer, but I think you're alluding to quite an important issue that we have with food allergy testing, and especially when it's done indiscriminately, and that's I'm not suggesting that this is the case for your daughter at all, but I just want to bring up this point. So sometimes when you have really severe eczema, you've just got a lot of allergy antibodies. So we call that IgE. And because you just have so much, and often these children have levels in the thousands when the normal is like under 80, because you just have so much of the antibody, you can have it for foods that you're not truly allergic to. So that can be tricky. So when a test is done and that's not focused on your true clinical history, sometimes what happens is we get false positives. So that's an important point to make about allergy tests, is that you can have false positives. And those are tricky things because they sometimes cause us to withdraw foods that children are not truly allergic to. And that's a really dangerous scenario because obviously there's a nutritional aspect to that. But also, if you withdraw the food and don't expose, as we said earlier, introduction is protective, there's the potential for that child to then actually go on and develop a true clinical food allergy to that food. So you actually cause an allergy by withdrawing the food. So I just want to make that point really clear. So if you're going to do food allergy tests, especially if your children have eczema, please make sure that they are done by someone who can interpret them well and also can order them appropriately, because there is this risk that's involved with potential false positive, and we really don't want to compromise our children's nutrition unnecessarily. As Lee said, living with food allergy is really hard, so you don't want to add to that burden by avoiding things unnecessarily and then potentially doing harm. My suggestion to your question, Michelle, would be to get an allergy trained dietitian involved, because this is a long list that you've got, and it's going to be hard. So you need to have a good meal plan for your child to make sure they're getting all that they need, that they're on the appropriate supplements, and again, just make sure those tests have been interpreted by someone who has good knowledge and experience with dealing with food allergy, because there might be a false positive lurking in there. Okay, I've got a question from Abigail, who says she runs a children's home and they're currently caring for an infant who is 4 months old, who's drinking Infocare formula. Should they change the formula? It hasn't yet started solids, but has severe atopic eczema, depigmentation of the skin, whole body, is on cortisone creams, but they're still struggling. Okay, so that's a really good question. So I think a lot of people who have babies with early onset eczema go through this. Is it the formula? So I want to make that point again. It's a minority of infants whose eczema is caused by their nutrition, by their food or their formula. The majority works in the other way. This baby would be potentially at risk of having a true food allergy because of the early onset eczema, because of the meeting the food through the skin instead of through the gut for the first time. So I wouldn't rush to change the formula unless the eczema is refractory. And then I would advise changing the formula to a non-calcium based formula. So you could try a soy formula or a rice-based formula. And I would do that for 2 weeks. And I would look at the skin very critically. I wouldn't change the skin management in any way to create confusion. If the skin is dramatically better after those 2 weeks, then yes, don't avoid the cow's milk-based formula. If not, it's not the formula. It's just genetic eczema. Just manage the eczema as such. Test this child before you introduce solids to make sure there isn't actually a food allergy in the mix. I think we have a few more minutes to look at more questions. What is the best way, the best test, to diagnose allergies and eczema? Nobody seems to know what's causing my child's rash. They're taking antihistamines, some topical creams during flare-ups. Okay, so the one thing I haven't touched on is environmental allergies that may be aggravating eczema. So we've mentioned a lot about food and eczema, but what about the environmental allergens? So like I said, not all children who have eczema have an allergy at all. It can just be that genetic barrier dysfunction of the skin. But definitely, yes, there are some children that have environmental allergies, and those too can be diagnosed by a blood test or a skin prick test. The one that we see most commonly troublesome is house dust mite allergy. So house dust mite is that little microscopic insect that lives in anything soft. So your mattress, your duvet, your couches, your fluffy carpets, their fluffy toys that they cuddle all night long, is probably teeming with house dust mite, and that can drive the eczema. So if that's a potential trigger, one would want to test for that. So again, a good idea to do proper allergy tests, either blood or skin prick tests, to make sure there's no environmental factors that are aggravating the eczema, and then potentially immunotherapy. So actually, like Lee did with the peanut for Harriet, doing the aero allergens for an environmental allergy can be very helpful in somebody with refractory atopic dermatitis. Okay, again, we're mentioning this problem with staph infections. The advice was to cut out gluten and dairy. So I would, again, really not be keen to do that. If you're getting recurrent staph infections that's driving the eczema, you need to treat the staph and the eczema. Don't cut out foods without good evidence that those are the cause. It compromises your child's nutrition. It's potentially completely unnecessary, and you could potentially actually cause a food allergy. So that's not good advice. So if that's a one take-home message, please don't cut out foods unless you've proven that they are implicit in the eczema, because it can do more harm than good. Is it too late to introduce my 2-year-old to allergens? And that's a really good question. Okay, so if you have not introduced allergens early, can you still introduce them? So I'm assuming your child is high risk, then that they have eczema, or potentially maybe a sibling or a family member that has a food allergy. My advice would be, yes, you want to get onto that introduction very quickly, but if your child is high risk, perhaps do an allergy test first with someone experienced in the management of food allergy and eczema, just so that you keep your child safe, because unfortunately allergic reactions are very unpredictable. So even the first introduction can produce a severe reaction, as we saw with Harriet. So we do want to keep children safe. So yes, we want to introduce allergens, but also we want to do so safely. I can see that it's already 1 minute past 8, and there are lots of questions still coming in, really great questions. I will be answering all of these after the event, so I'm sorry if I didn't get to your question. We will do so. We're so grateful to Lee and sharing her story. I'm sure that there are many people that are going to have taken a lot out of just hearing a shared experience. Thank you to Claudine as well, just as heading up our advocacy group. I hope that people will be encouraged to join the group at least, and possibly even attend our event in Joburg in August. We really want to be a positive change for people out there with eczema and food allergies, and this is the one way that we're working to do so. Thank you again if you've joined us, and if you've given your questions, we appreciate it, and we hope this has been a beneficial evening. And please continue to post, please share this event far and wide with those that you think may benefit from it. Thank you, and that's me, Candice. Closing the event now, and thank you to all involved. Thank you again to Sanofi for being our sponsors this evening. Good night.